Hi, everyone, and welcome to the muscular system. So, first things first, let's look at a muscle. Okay, so the study of the muscular system is called myology. So, myo, muscle, logy, study of. Anytime you see myo, M-Y-O, anywhere, assume that we're talking about muscles. So, this is a cross section of skeletal muscle. Some things I do want to talk about so you guys know the definition of. So we've talked about a tendon, it attaches muscle to bone. We're going to talk about the different types of muscle. This one is specifically skeletal muscle. But we're going to talk about that in the muscle tissues lecture. What I do want you to familiarize yourself with are some of these terms. So we have fascia right here. Fascia is just a layer of connective tissue between the muscles fascia also separates the muscles from the skin, right? A fascicle right here, that's a bundle of muscle fibers ensheathed in connective tissue. So multiple fascicles constitute a muscle as a whole pretty much. And then we have right here, you see paramecium, endomecium, and epimecium. So these are just layers. Endomecium is the innermost layer. It directly surrounds individual muscle fibers. Paramecium is a thicker layer that surrounds groups of muscle fibers called the fascicles that we just said the definition of. And then the epimecium, that is the outermost layer. It covers the entire muscle and it attaches the muscle to the surrounding structures like bones or tendons. So that's just a quick look at different layers of connective tissue and what all of the definitions there are. All right, so we just talked about fascicles. So remember, fascicles are a bundle of muscle fibers or muscle cells that are grouped together in a skeletal muscle. So here's some arrangements. Okay, so we're looking at the classification of muscles by which direction the muscle fibers go, and how the muscle fibers are kind of grouped together, right? So first we have circular muscles. So circular right here, A. So these we call sphincter muscles, and when they contract, the hole in the middle closes up, like you would think a sphincter does, right? So that's where we're talking about circular muscles and the lips, the eyes, the anus. There's a sphincter muscle at the end of the stomach, the organ. Those are all round, and when they circular and when they contract, that open hole in the middle closes up. Then we have convergent muscles or triangular. You'll see both. So convergent, triangular, same thing. Those are used interchangeably. They have a really broad origin and a narrow insertion. So what does that mean? Okay, so let's look at pectoralis major. So pec muscle, B, right there. It's triangular in shape, right? It's got a broad origin on the sternum right there. And it's got a very narrow insertion right there where it goes down into a single tendon on the humerus. Remember, a tendon is a tough band of dense connective tissue. It attaches muscle to bone. Tendons also transmit the force made by the muscles to actually move the skeleton, right? So that's pretty cool. So that's convergent or triangular. Parallel muscles are strap-like, so C right here. It's the sartorius muscle right there. So it's skinny all the way, end, middle, end. So tendon, muscle, tendon, all pretty much the same thickness throughout, pretty skinny. The sartorius muscle specifically in this example acts like a tie down to keep other muscles in place, and it helps externally rotate the thigh out. That muscle basically helps you sit crisscross applesauce. Unipennate So uni 1, pennant actually means feather-like. So this is one feather. So D, unipennant right there. So see how this is shaped? It looks like half of a feather right there, unipennant. So that would be the center of the feather, and that's just one half of the feather. Basically, all the muscle fibers are running into one location. Here, the example is the extensor digitorum longus. So lower part of the leg, and it's got it is a unipennant muscle. Bipennant, on the other hand, is actually feather shaped. So you can see that would be the center of the feather, and then you got the muscle fibers going towards the center. Both halves are running towards the middle. It's a full feather. That's what bipennant is. This example is a rectus femoris muscle. So right there. And you can see the bipennant nature. This is actually part of the quad muscle set, which we will talk about and look at. But so both halves are running towards the middle or the center of that muscle, and on each end there is a single tendon. So single tendon, bipennant muscle, single tendon. Fusiform, so this is to differentiate this one from parallel. They can have 1 to 2 tendons on each end, and they're going to be thicker or fatter in the middle. So where parallel is skinny all the way through with a tendon on each end, fusiform is thicker in the middle, and it can actually end in more than one tendon. Let's see, multipennant. Right here, do not confuse multipennant with convergent or triangular. So although it's a triangular shape on this deltoid, multipennant basically has a bunch of unipennants that hook into one tendon. So here on the deltoid, you can see there are multiple unipennants. So that's one, that's one, that's one, and that's one. And they're all hooking down into this one tendon. And that's on the deltoid, so right there, E. So again, even though they resemble that same triangular shape, these are multiple unipennants, and they're not just one single convergent muscle. And this comes down to a tendon that attaches to the humerus. Okay. So here's some more examples of fusiform, parallel, triangular, or convergent, unipennant, bipennant, multipennant, and circular muscles. Okay. And then we actually have a PDF that I posted of muscles that we're going to look through. Basically, I want you to know the highlighted ones, and I want you to know what the muscle is, where it's located, and what it does. So what the action is. So what it is, what it does, where it is. So the action, for example, for what it does it extend? Does it flex? Does it adduct? Does it abduct? Does it rotate? What does it rotate? When you contract, which way does that rotate? Which we'll talk about here shortly. Again, I've posted a PDF. I'm going to bring that up right as I close this. But definitely take your time learning these. On this picture, you basically need to know everything. And we'll go through the specific sections here shortly. But if you try to memorize these last minute, you're not going to retain anything. So please start studying early. Flashcards do take a while to create, but they are super helpful. So as you make them, you'll start retaining things, and then you can just use them for practice. Repetition is key, and repetition will help you be successful in learning these different muscle groups and specific muscles, and again, what they do and where they're located. Okay, so this is the PDF that I've posted. Again, what's highlighted in yellow is what I want you to know. I want you to know the name, the location, and the action. Where it's located, what it does, and what its name is. So first, we're going to talk about the frontalis muscle, that one's pretty easy. That's the forehead muscle right there. And orbicularis oris. So orbicularis, round, orb, right? Oculi, talking about vision, ocular vision. So what does the orbicularis oculi muscle do? It circles the eye. That one allows you to squint. So the frontalis and the orbicularis oculi are both muscles used in eye expressions. So the next grouping here are eyeball movers. So we have muscles that are specific to moving the eye itself. So number 5 through number 8, superior, inferior, medial, and lateral rectus muscles are all involved in that. And then numbers 9 and 10 here, superior oblique and inferior oblique, are also involved in actual eye movement. So the superior rectus is the top of the eye. When it contracts, it pulls the eye up and allows you to look up. So that's number 5 right here. It's that muscle. The inferior rectus, number 6, right there. That one, when it contracts, it pulls the eye down. So it's on the bottom. The medial, that's the nose side of the eye. It moves or pulls the eye towards the nose. So medially, right? Medial rectus. And then the lateral rectus does the opposite of that. It's the outside of the eye, and it spins the eye away from the nose. So it lets you look laterally, moves the eye laterally. And that one, number 8, is right there. Okay. Then we have the superior and inferior oblique muscles. So the superior oblique, it basically goes through a pulley. So that's right here, this right here. And it attaches to the outside of the eye, and when it contracts, it goes down and out at an angle. So it allows you to look down and out. Whereas the inferior oblique, it wraps underneath the eye. So number 10 there, that's the inferior oblique muscle. And when it pulls, and when it contracts, it makes you look up and out. So superior rectus, inferior rectus, medial and lateral rectus, and then we have the superior and inferior oblique, and all of those are eyeball movers. So know which direction. So superior pulls the eye up, inferior pulls the eye down, medial pulls the eye towards the nose, lateral away from the nose towards the outside of the eye, superior oblique down and out, inferior oblique up and out. Okay. Then we have our mouth movers. So these are muscles specifically involved in moving the mouth. The zygomaticus major muscle, origin zygomatic bone. So you remember that? That's the cheekbone, right? This is the smile muscle. So number 13 here, smile muscle. Pulls the mouth up, goes towards the zygomatic process. Depressor anguli oris. So read that. Depressor anguli oris, oris mouth. Depressor down, lowers, right? So depressor anguli oris, that is our frowning muscle. So it brings the corner of our mouth down. So that one's number 16. So that one's right here. That one contracts. It brings the mouth down. We have our orbicularis oris. So that encircles the mouth. That's that circular muscle we were just talking about, the sphincter muscle. So circular muscle around the mouth. Orbicularis oris. Number 18, it just encircles the mouth, as it says. And then we have the platysma. So the platysma, number 19, that's this really big muscle right here. It starts below the chin and covers the front of the neck. And it's a big, flat pat. So remember, flat platysma muscle. Then we have our mandible movers. I want you to know the masseter and the temporalis. So the masseter, that is the muscle that you can actually feel popping out of the side of your cheek when you clench your teeth. That's what the masseter is. So it elevates the mandible, it helps you close your mouth, and it helps you chew. So when we chew, we call that mastication. So masseter, mastication, helps you chew, and that's the muscle that pops out when your mandible elevates. So right there. And then 21 is your temporalis muscle. That one covers the temporal bone. It also assists in closing the mouth and in mastication. So both of those assist in chewing. Remember, mastication, masseter, and then the temporalis muscle also assists in that. Helps elevate and retract the mandible, helps close the jaw. And then that is where mastication happens, where chewing happens. Then we have our tongue movers. We have the genioglossus muscle that helps you stick out your tongue. So that one's 24. That's down here. Number 24. And then 25, the styloglossus muscle. Okay, so it's called styloglossus. 25 actually attaches to the styloid process of the temporal bone. So remember the styloid process in the temporal bone? Styloglossus. That muscle actually brings your tongue back into your mouth, so it retracts. So genioglossus sticks your tongue out. Styloglossus brings it back in. And styloglossus muscle attaches to the styloid process, which should help you identify its location. These are all swallowing muscles, 27 through 34. You can read through these. You can study them if you want to. I'm not going to make you memorize these. But remember, I told you the hyoid muscle is, or the hyoid bone is the only bone that doesn't articulate to the skeleton. Well, it's held together by these muscles and ligaments, and all of this is involved in swallowing. Okay. Whole head movers. So the SCM, or the sternocleidomastoid, that's the only one I want you to know here. That is the whole head mover. SCM for short. Sternocleidomastoid helps you turn your head, but it works opposite of what you would think. So if the right side of your sternocleidomastoid, if the right sternocleidomastoid contracts, then it actually helps pull your head towards the middle of your body, and it moves your head to the left. So look at how it attaches here. Number 35, right there. From ear to sternum. So it causes rotation as it comes down in this angular motion. So if right side contraction causes your head to turn left, then conversely, left side contraction of the sternocleidomastoid would rotate your head to the right. So remember that, don't get that confused. So it's a prime mover of active head flexion when they act together. Rotates the head towards the opposite side when they act singularly. So that is the sternocleidomastoid. Okay. Next, we have our torso extenders. So the three involved specifically in torso extending are the erector spinae muscles, and they do exactly what you would think. We have let's look over here. We have 38A right here, the erector spinal iliocostalis on the outside, 38B, erector spinal longissimus, and then 38C, erector spinae spinalis. So to remember that, I love spaghetti. So iliocostalis on the outside, longissimus on the inside, and longissimus in the middle and spinalis on the inside. But you can easily remember that too by along the spine, spinalis. So I, iliocostalis, love longissimus in the middle, spaghetti, spinalis in the center. The closest to the spine. And then we also have, but anyways, those are in charge of making the spine erect, right? Torso extenders, the erector spinae, make sure the spine gets erect, extends the vertebral column, and helps you stand straight up. Okay. Then we have the quadratus lumborum. So that's a four-sided muscle in the lumbar region. That's actually right here in this section. This quadratus lumborum, or the QL muscle, is what you usually feel when you feel tightness in your lower back or lower back pain. That is the QL muscle right there. Okay. Helps also maintain upright posture, assists in forced breathing. And those are our torso extenders. All right, breathing muscles, the only one I want you to know is the diaphragm. You're going to hear about the diaphragm for the rest of your anatomy career. That is the muscle for breathing. Prime mover of inspiration, flattens on contraction. Inspiration just is talking about breathing in. Okay. 43 through 46 are all abdominal muscles. So the rectus abdominis, that's our six-pack. Number 43, right there. Rectus abdominis, six-pack. It helps to flex, rotate lumbar region. Let's see, fix and depress ribs, stabilize pelvis during walking, increase intra-abdominal pressure. Basically, they curl like you're doing a sit-up, right? You do sit-ups to try and make a six-pack. Those are our rectus abdominis muscles. Our external oblique, external outside, those are right here, number 44, and they wrap around at an angle down to the pubis. We have our internal oblique, number 45, so that's actually right there. They're the same as the external oblique. They're just the middle layer. They are not the center. They're just the middle layer. And then we have our transverse abdominis, and that is the inside layer right there, number 46, TA for short. And that one is the deepest muscle, and it basically keeps all your viscera in place. Number 46, transverse abdominis, or TA. Number 47, that's a pelvic floor muscle. It is the only one I want you to know. It's called levator ani. And those are your anal muscles. It lifts the anal canal when you defecate. It forms the sphincters of the anorectal junction in the vagina, and it keeps your pelvic contents from falling out, pretty much. So, levator ani. And that's number 47, so that's right there. So it circulates the sphincter. Or it forms the sphincter, right? So you know where it's located. It's going to be located around the anus. Okay. Then our shoulder movers. All right. So pectoralis minor, that helps elevate the ribs, and it runs from the rib to the shoulder. So that's number 49 right there. This is not the pec that you would associate with exercising and working out specifically. When people are saying, oh, I'm working on my pecs, they're not talking about pectoralis minor. Okay, so this is pectoralis minor, and it is helping in shoulder movement. Draw scapula forward and downward. Drops rib cage superiorly. Scapula fixed. Scapula. Uh-oh. Oh, well. The serratus anterior, that's the boxer's muscle, number 51. So right there. That one keeps your shoulder blade down, rotates the shoulder blade, helps raise your arm up and out. It abducts and elevates. So remember, abduction versus adduction. Adduction in, abduction out. So serratus anterior is an abductor. It helps raise the arm up and out. And then number 52, trapezius. So now we're looking posteriorly. We're looking at the back. Trap muscles right there, trapezius. You call it the trap muscles when you're exercising, but that's a big triangular muscle on the back. And there's an upper, middle, and lower part of the trapezius. And depending on what you're looking at, it can help you move your arm, rotate your shoulder, rotate your head. Trapezius is a really big muscle on the back. Then we have the levator scapulae. Elevates the scapula, number 53. That one's right there. It helps bring your head down to your shoulder, basically your ear to your shoulder. That's the levator scapulae. And then we have the rhomboid minor and the rhomboid major. So those are the muscles that are between the scapula back here. It helps bring your shoulder blades in towards your spine. So 54 the minor, and then 55 is the major right there. Okay, then we have our arm movers. So pectoralis major, number 56, that is what we would associate with the pec muscle when we're working out. That's our big chest muscle from sternum to humerus, and it helps bring your arm across your chest, basically. Then our lats, number 57, latissimus dorsi. So that's on the back right there. Those are our lats when we're exercising or working out. Latissimus dorsi, big broad muscle across the side of the back from the spine to the arm. And it helps with arm extension and adduction. So rotation of the arm, palm out, and then back to medial. So our lats when we're working out right there, latissimus dorsi. And then we have our number 58, our deltoid muscle right there. So delts, we would call them, that's the cap of the shoulder muscle, and it attaches at the humerus. It attaches at the deltoid tuberosity on the humerus. That's actually where the tendon attaches. So it's at the humerus, the spinous scapula, to the clavicle. A little bit of the clavicle anyway. It primarily abducts your arm, so it raises your arm out to the side. And then right here, when we get to supraspinatus, infraspinatus, subscapularis, and teres minor, those are our sits muscles, or sit-ins. And those are all part of the rotator cuff. So not teres major. So that's why we say sit-in. So sit-in muscles. They are our supraspinatus, infraspinatus, subscapularis, and teres minor, but not teres major. So our supraspinatus muscle above the spine of the scapula, number 59, right there. That one, if your arm is down, this one pulls it up. Basically, it stabilizes the shoulder joint. And again, like I said, it's part of the rotator cuff set. Doctors do an empty can test to test the strength of your supraspinatus muscle. So you would bring your arm straight out but at a 45-degree angle, and then you would move your hand like you're pouring a drink out. And then your doctor is going to push down on your arm while you resist to test the strength of your supraspinatus muscle. And that's the not location, but that's what's getting tested, and it's located right there, supraspinatus, above the spine of your scapula. And then number 60, the infraspinatus, so right underneath it, inferior to the spine, under supra. Basically, that's another shoulder stabilizer, and it rotates the humerus out. It's involved in lateral rotation, so palm down to palm out. Again, part of the rotator cuff set. So supraspinatus, infraspinatus, subscapularis, also part of the rotator cuff set, front side of the scapula. So 61, subscapularis right here, front side of the scapula. You're not going to see it back here. You can see it anteriorly. Keeps the head of the humerus in the socket, which is really important, right? It also rotates the humerus along with the pectoralis major. And then we have our teres minor, number 62. Teres minor helps the lats. It helps bring the arms back and rotate the thumbs in toward the body. So if you're putting your arm to the small of your back, oh, I'm sorry, that's a teres major. Teres minor is the same as the infraspinatus. I'm sorry. Teres minor is the last part of the rotator cuff. It's a helper. Teres minor. So number 62, find it right there, teres minor. It helps the infraspinatus muscle. The teres major, which is not a part of the rotator cuff, the teres major, that one helps the lats. That one brings the arm back. So that one's number 63. right there. That one helps lats. It brings the arm back, rotates the thumb in toward the body. So with the teres major, if you're putting your arm to the small of your back, that's the muscle that you're working there. We call that posteromedially extending, medially rotating, adducting the arm. All right, then we have our forearm movers. We have the biceps brachii. That's the front of the arm. That flexes the forearm at the elbow, flexes the arm at the shoulder. So we all know where our biceps brachii are located. So number 65 is right there. Brachialis, number 66, that's our helper to our biceps brachii. So number 66 is right there. Or right there. Number 67, brachioradialis, right here. That's another stabilizer muscle. It's on the forearm. It keeps you from hyperextending and hyperflexing, so it helps with forearm flexion, and actually is best when the forearm is already partially flexed. And then we have our triceps brachii. So back of the arm, posterior arm extends the elbow. Triceps, there's 3, so 68-1, 2, 3. Triceps brachii. It's an agonist of forearm extension, antagonist of forearm flexor, stabilizes shoulder joint, assists in arm adduction. It's going in. And we have our forearm rotators. Our pronator teres pronates the forearm. So if elbows are bent and palms are up, this turns your palms down. If you can't remember that, remember the supinator. So the supinator is an antagonist of the pronator teres. It does the opposite. So this turns your arms like you're holding a bowl of soup. So if you can remember that, then you can remember the opposite of that, which is the pronator teres. So pronator teres is number 70 right there. The supinator is number 71 right there. Our wrist flexors, flexor carpi radialis and flexor carpi ulnaris. So this is exactly what it sounds like. Flexor of wrists, radial side, flexor, wrist, ulna side. So what does that do? It flexes the wrist toward the radius. Remember, where's the radius? Thumb side, thumb side. And then flexor carpi ulnaris, that one flexes the wrist toward the ulna. Pinky side. Ulna's on the pinky side. We have our wrist extenders. So we have our extensor carpi radialis longus. Extends the wrist toward the radius. And then our extensor carpus ulnaris extends the wrist towards the ulna. Pretty self-explanatory there. Then we have our finger movers. Flexor digitorum superficialis. It's a superficial muscle that flexes the fingers. Our extensor digitorum, it extends the fingers, it straightens them. Our extensor digit minimi, so this specifically extends the pinky finger, like when you would think that you're drinking tea, and the little pinky finger pops out. The pinky finger actually sticks out better because it has this extra muscle. Oh, and we didn't talk about where they were located, but 77, flexor digitorum superficialis, 78, extensor digitorum, and then 79, specifically for the pinky finger, extensor digiti minimi. And then 75 and 76, located at the wrist. There's 76 right there. And then 74, the flexor carpi ulnaris there. And then 72, flexor carpi radialis there. And we'll look at models if you're in person as well. Okay, then we have our thigh movers. Sartorius muscle, we've talked about, that's the strap-like muscle across your thigh. It helps you sit with your legs crossed. It's number 82. The the iliopsoas iliacus, and then the iliopsoas major muscles. When these two muscles come together, they form an iliopsoas. So the iliacus, number 83, is the inside of the ilium part, and then the psoas major is next to the spine. So number 84 is going to be next to the spine. And number 83 is going to be by the iliac. And when they come together, they form the iliopsoas muscle. The gracilis, it's a graceful little muscle, number 86. It's right there on the inner thigh. It's the inside of the thigh. It adducts the thigh, so it brings it in, and it gives shape to the inside of the thigh. Now, athletes, really strong athletes, you can see that muscle on. Most of us, you won't be able to see, but it gives that inner thigh shape. The adductor longus, another inner thigh, it helps squeeze the thighs together. It adducts. So if you have a ball between your knees and you are adducting, squeezing that ball, the adductor longus muscles, primary in that. That's number 88 right there. 89, tensor fascia lata. It's not latte, it's pronounced lata. But TFL for short, that's the outside of the thigh near the hip. So number 89, where are you? Oh, it's going to be on the outside. I don't really see it here. Anyway, we'll look at it in person. TFL. Outside thigh near hip, it's the iliotibial tract. Okay, it's right here. It's part of the iliotibial tract. And it abducts, so moves your leg out, or moves your thigh out. And then we have our gluteus maximus, medius minimus. So those are our butt muscles, right? So gluteus maximus, that's a big glute on the outside. It's our external rotator. It brings our legs out and around. Gluteus medius is the middle part. So number 90, gluteus maximus. Number 91, gluteus medius. And then number 92, gluteus minimus, middle and inside. Medius middle, minimus inside. We have our hamstring muscles, our biceps femoris, semitendinosus, and semimembranosus. Biceps femoris, semitendinosus, and semimembranosus. Hamstrings. Popliteus, that one's just underneath the knee, but I'm not going to make you know that. Quadriceps. We have 4, rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. So those are our quadricep muscles. 97, rectus femoris. 98, vastus lateralis. 99, vastus medialis. And number 100, which is our vastus intermedius. And then our foot movers, we have our tibialis anterior, 101, right there. Anterior to the tibia, front of the tibia. Fibularis longus, that runs the length of the fibula, number 102, right there. Just runs alongside the tibia. And then our gastrocnemius muscle, number 104, that's your calf muscle. Muscle on the back of the calf. And then we have our toe movers. So remember the toe is called the hallux, right? So what do you think the extensor hallucis longus muscle does? It extends your big toe. So extensor hallucis longus extends the big toe. The extensor digitorum longus extends the rest of the toes. The flexor hallucis longus flexes the big toe. And then the flexor digitorum longus flexes the rest of the toes. So 107, right there. 108, right there. 109, 110. And that's it. And that's it for our muscle chart.